Our presentation is on attention deficit hyperactivity disorder, also referred to as ADHD. First, we must understand the disorder before we learn how to accommodate it. Before we get started, let's get some preconceived notions out of the way. ADHD has nothing to do with your parental or teaching skills. ADHD is a brain-based biological disorder, and it is not the inability to control your children or keep them on task. This disorder could last a lifetime. Many parents feel that this disorder is just a phase, and in time, their kids will grow out of it. But it is more likely that this disorder will remain for the individual's entire life. Many people feel that if an individual has ADHD, simply give them some sort of medication and they'll just be fine. Although medication can be required in some cases, there are also techniques and strategies that we as teachers can implement that can help a student with ADHD be successful inside the classroom. Although ADHD has hyperactivity in the name, you must also understand that there are different types of ADHD. There is ADHD hyperactive impulsive presentation. These individuals have symptoms of hyperactivities and they feel like they must constantly move, and they really struggle with impulse control. There's ADHD predominantly inactive presentation. This is what some people refer to as ADD, which is simply attention deficit disorder. Notice that the activity is absent. These individuals typically have trouble paying attention and are easily distracted. They do not have the same issue as impulsivity as hyperactive patients do. And finally, last type of ADHD is a combination between the two previously listed. ADHD combined presentation. There's a reason why when you hear ADHD, you picture an individual who's constantly fidgeting and moving while having a tough time paying attention. This is because these individuals are by far the most common version of ADHD. They show difficulties in both impulsivity and attention. The symptoms of ADHD can be broken into 3 categories, which helps list them into what type of ADHD they actually have. These can be signs of inattention, hyperactivity, and impulsivity. Signs of inattention can be anything from being confused or appearing to not be listening. The student finds it hard to concentrate and becomes easily bored with activities. These individuals might struggle with getting organized and finishing tasks, or having difficulty learning new things and following directions. Signs of being hyperactive can be anything from constantly talking, moving from place to place quickly and frequently, fidgeting, and having trouble sitting still for quiet activities. Signs of impulsivity are being impatient, blurting out answers and interrupting, maybe overreacting to situations, and not really understanding the consequences to their actions. It's worth noting that many of these symptoms don't appear or are not as apparent until children actually get into the school system. Some people with more severe cases can be diagnosed as early as preschool. Students with ADHD may have skills affected which can impede on their learning, such as keeping a train of thought, seeing a project to the end, managing their time. They might have troubles reading and recognizing social cues. They may have trouble controlling their behavior and making friends. They really struggle with taking turns in conversations and they tend to interrupt, and judging on how much space to give someone. Despite many studies, researchers are really unable to determine the exact cause of ADHD. Although many researchers believe the main cause to be hereditary, there are factors that increase the odds. These can be exposure to pesticides in early development, a premature birth, a low birth weight, differences in the brain, and brain injury.
So ADHD not only affects students, but it also affects teachers. Teaching students with ADHD takes a lot of patience, creativity, and consistency. 5% of all students in Canada have been diagnosed with ADHD. Boys are 3 times more likely, and symptoms usually arise between the ages of 3 and 5. 75% of cases continue through adolescence into adulthood. It may be hard for some of us to understand what our students with ADHD are dealing with on a daily basis. For those of us who don't struggle with ADHD, if you have a few minutes, check out the link that's posted on slide 10, and it'll give you a better understanding of what some of our students who have ADHD might be dealing with on a daily basis.
As a future teacher, there are factors that we need to support students with ADHD, such as environmental, instructional, and personal. Environmental factors can consist of some students may be distracted by movement, Some students cannot concentrate with background noise. They don't always work well in groups, as they often keep the rest of the group from staying on track.
Some examples of instructional factors would include trouble following instructions. Some students may often be forgetful about homework. They have problems with long-term projects and projects where there is little direct supervision, and they are easily distracted and tend to have a short attention span.
Some of the personal factors can be impulsive and do things without thinking them through. The students may need more attention than the other students and will be distracted with the rest of the class and may not notice that they're doing it. Many students receive negative feedback and have negative interactions with their peers, which could lead to low self-esteem.
Interventions and strategies begin with being proactive, positive, and patient. Being proactive also includes having strategic seating so you can manage outbursts and those who need more quiet. You can also have organizational tools like checklists, using colors, also making sure that you tell them what they are going to learn for the day. You're also going to explain their expectations that you have for them in their behavior and how they're going to work as an individual or as a group. Laying out SMART goals will help them improve their behavioral challenges. Also, chunking lessons will help minimize them getting distracted by too many tasks at one time. Fidget tools helps with the physical aspects. Some good ones are having a tension ball for squeezing, even fidget spinners. And also there's a cushion that they can sit on that keeps them off balance, which they constantly have to use their core. Being positive is also important. Using your tone, your body language, and the words that you use, constantly reassuring them that they are on track. Being patient is the last component to your strategies. You have to leave room for the unexpected. You also have to have certain tools or strategies in place for someone who is a mover, like sending them on errands. Also, to make sure that you do not single out individuals and come up with small cues to let them know that they need to adjust their behavior. Also, give a lot of breaks to your routine. Be consistent.
It's important that we understand this disorder and that every student, we realize, is in a different spectrum. Some of these symptoms might not affect every student, therefore we have to take all this information and apply it with whatever suits that student best.
With this disorder, it's important for educators to accommodate students despite their challenges in everyday life.
With the help of the educators, students will be able to succeed in the learning community.
Staying creative will help you continue to increase your awareness with these students. Staying focused and staying connected to the ministry and the changing environment of education will also benefit you as a teacher.